Okay, everybody, I'm going to go ahead and give you just a small introduction again to Docucare, just in case you need this again. So, once you are in there, which everybody should now have access to their Docucare. I asked many times if anybody still needed to get in. I helped several people get in. So at this point, everybody should be good to go. So when we get in here, all right, we are going to, let me go back and see if I can. Go in here really quick for 3010. I'm going to preview it as a student so you know what it looks like. Okay. Go in here. Perfect. Okay, so the first thing that comes up again is it's probably going to make you put in some information. If it asks for a name or initials, that's fine. You can go ahead and put that in and fill out that little thing. And once you hit submit, it should come to this piece here. So patient info is the first thing. It shows lots of different things, obviously. You can put in the height, weight, marital status, religion, race, ethnic category, ethnicity, primary language, occupation, employer, so on and so forth. And then you can click save. And that's really important to click save. I mentioned that in the hospital setting, a lot of times it just automatically saves it, but you want to make sure that you have that in there. So this is where in your 3030 course you're going to be learning how to do a head-to-toe assessment, and this will give you a really good idea of what is included in a head-to-toe assessment. Okay? It starts with the HEENT, which is head, eyes, ears, nose, throat, and it's going to go down it, and you can click on the different areas. I definitely suggest you keep going in here and playing until you have a better idea of what different things are in here. So each week when you go to clinical, if you practice neuro and health assessment, we're probably going to have you do neuro assessments in the clinical setting. And we actually have ones that you can go ahead and print off and bring them to the clinical setting to make sure that you are not missing anything and that you have a chance to kind of document a little bit. We want to make sure, though, obviously, that we don't have any patient identifiers on those forms. Here's the cardio one. Again, going down, has the heart tones, pulses, edema. All this stuff is things that you will be learning how to do. Respiratory, we have gastrointestinal, then we have the GU, musculoskeletal, mental health, pain scale, integumentary, and vascular access. So that's if we needed to add any type of IV. So that's all just under assessment right here. Okay, so we started with patient info, we went over to assessment. So in the hospital, when you do an assessment, a lot of the stuff you'll be going through, not as extensive as we're going to have you do in your head to toe. We do something more called a focused assessment in the hospital, and that's when we focus in on what's actually going wrong with the patient. There are some standard things that we assess no matter what, but then again, we focus on what's going on. ADLs, activities of daily living, you would be able to chart on that, and this is some of the stuff that you just learned today about with the hygiene and whatnot. So some of that stuff would possibly be on here. Let's see if it has personal hygiene, that kind of stuff. So anytime they've done this, we can click on it. There isn't really an area that usually in the hospital that says, that you change their linens. That's not normally something we do. We just automatically usually change it according to the policy. At some places it's done every day, other places it's done every other day, or unless it's soiled. Then we have the notes. So you're going to be practicing doing notes as well. So let's say that you call the physician and you had a conversation about something related to your patient. Let's say your patient is really restless and you were hoping to get something to get that patient more calm. So what we would do is after that phone call, whatever time it started, we'd put that in here. We'd select the type. And this one would be that we were provider notification. And we would literally be just typing it in on, physician was notified. Actually, you could put the actual name of the doctor. So Dr. Smith was notified of patient condition. Patient, and then we would just go on and say what's going on with the patient. Patient states that he feels anxious. Patient appears to be restless, and we can just go on from there. And we could say if new orders were taken, we could even say orders received, and then we can either sign our name, or if you click on this, it signs it for you. So that's some stuff that we'll be practicing this semester and as you're going through. And this way, no matter who comes behind me, they can look at, oh wow, okay, Sean had a little bit of difficulty with a patient who is very anxious, had to call the doctor, had to get something. So that's the perfect place that we can put that kind of stuff. Then we have our nursing diagnoses. You're going to learn more about this as we go, so I'm not going to dig into this a lot right now. But just know that we have these great tabs here to help you create those nursing diagnoses. So when you have to do that in clinical, it's here for you. This is where we could add an order. Talked about this today. If we needed to add a new medication order, we could do that. We can, is this a scheduled or is it continuous infusion? PRN, meaning as needed. So they've got lots of things on here that we can go in and select. Oh wow, actually has a Smith on there. That's interesting. Okay. Let's see here. And then if it needs to be a stat order, meaning now you have to do it right away, you can put that on there, and that way wherever this is going, if it goes to pharmacy, they know it needs to be done immediately. If it's a lab order, again, it would be done immediately if you click on that stat. Okay. All right. So MAR, medication administration record. Okay. So you can add the home meds down here. You also have the other medications up this way. That will be stuff that they're currently taking in the hospital. Sometimes the home meds are taken in the hospital, but sometimes they're not all taken. We usually clarify what needs to be taken. INO, that means intake and output, so you can record the intake. Blood products, tube feeding, IV push, oral intake, other intake, okay? And then record output type, and it has it all on here. Everything from chest drains, chest tubes to drains to wound vacs, emesis or vomiting, diapers. We actually weigh the diapers. That's for just the little ones. And then stools, either the number or if it's a loose stool, we actually measure the amount in milliliters. And then the urine, okay? So all this stuff is things that we will get to practice this semester. Vital signs, you'll get to do a lot of that fun stuff. You'll be putting in the blood pressure, the location of where you actually took it. There's lots of different areas we can take the blood pressure. Were they lying down, sitting up, lying on their left side, right side, were they prone? Those are different things that you'll be talking about a lot in health assessment. Okay? Diagnostics. So any labs that are ordered, so you can always go in if you had to add a new lab. It has them all here, the main ones anyway. And you'll be learning about those as well. You're going to be pretty proficient at charting by the time you get done with this nursing program. Here is OT, occupational therapy. you'll see all the stuff that they would be able to put in here. This is not necessarily things that we would be typing in. More so, we would be reading what the occupational therapist has put down, and if there was anything we needed to do while we were going through their treatment. Physical therapy, same thing. What kind of things are we doing for the patient to get them up and moving? Different forms. We talked about this, the incident and near miss reports. So that will be some fun stuff that we get to go through this semester. And then that last one, haven't seen exactly how that one works yet on the actual flow sheet. All right, so that is the main thing there. As you're looking up here, it says show learning tips. Let's see what it has there. Some of the stuff, it looks like it just has a little introduction of what's going on with the patient and their age. A little screenshot there. Are there any attachments? And there is not. If you want to review things, so this would be actually you going and doing whatever, reviewing all the work that you charted on. And then if you hit submit, this whole thing pretty much disappears. So just kind of know that if it disappears, it's probably because you hit submit. Otherwise, if I just close out of this and come back in, it's still here. Okay? All right, so that's about it on that. I'm going to go ahead and stop this one and get this uploaded for you guys.